cases are surging across the nation, and Maine's hospitals are feeling the pressure.
Maine CDC Director Dr. Nirav Shah says the number of Mainers in the ICU because of COVID-19 is at a pandemic record high. Let's take a look at the numbers. Today, 193 people are in the hospital because of the virus. 74 are in critical care. 38 are on a ventilator. In the entire state, just 43 critical care beds are available.
During a press conference yesterday, Dr. Shah said 95% of the COVID patients in our ICU beds are unvaccinated. So for those still unvaccinated, the U.S. CDC is busting some myths about the vaccine. One claim out there is that the vaccine changes your DNA. That's false. Let's verify. Let's start with the claim. Will the COVID-19 mRNA vaccine change my DNA? We've seen and heard this claim all over, so much so that nearly every state health department is taking to Twitter to fight this myth. Our sources are the U.S. CDC and Maine CDC Director Dr. Nirav Shah. The U.S. CDC says the COVID-19 mRNA vaccines deliver instructions, genetic material to our cells to start building protection against the virus. But that material never enters the nucleus of the cell, which is where our DNA is kept.
Even the mRNA vaccines, which I know folks have questions about, are nothing more than a couple of particles of mRNA, a fat cell, and a compound called PEG, which has been injected into people as part of other medications for decades, and a little bit of salt. That is all they are. If there were long-term considerations from these, then we would have started to see them based on other mRNA vaccines.
The U.S. CDC says other mRNA vaccines that have been studied before include flu, ZIKA, rabies, and more. So we can verify this claim is false. The COVID-19 mRNA vaccines do not alter your DNA.